Sounds good.
Okie dokie. So we've got some folks that are already early arrivers and are popping in already, which is always exciting to see. I'm sure they're very excited to be able to see what you're offering today, Dr. Carlson. All right, I'm going to make sure that for our audience on Facebook Live, we're good to go. Awesome. All right, I'm going to give us just a minute or two to let folks get into the room, and then we are going to go ahead and rock and roll for today. See some friendly names. I don't get to see faces today, but it's always nice to see friendly names with us and familiar members of our community. We've already got some positive feedback for you. We've got Leah super excited for this webinar. Leah, we're very excited to have you here with us today as well. So with respect of time, I'm going to go ahead and welcome each and every one of you on behalf of the Southeastern School Behavioral Health community, as well as the Behavioral Alliance of South Carolina. We are very excited today to have with us Dr. Ryan Carlson from the College of Education Counselor Education Program here at the University of South Carolina. Before I turn it over to Dr. Carlson, just a little bit of housekeeping. Dr. Carlson has graciously embedded time for Q&A at the end of our presentation today. So keep your questions in mind, maybe write them down on your notepad, as I know you're going to be taking notes as we go through our presentation today, and then we'll make sure to attend to those questions at the end. For those of you wonderful humans that are joining us on our Facebook Live, again, thank you so much. If you have questions, please make sure to put those in the comment box. And then at the end of our presentation, I'll be sure to field those over to Dr. Carlson. If you are hoping to get CEUs for today, and we certainly hope that you are, we offer general education CEUs. You can email us at basc@mailbox.sc.edu or at advancingSBH@mailbox.edu in order to receive your CEUs for today. We do ask that you participate in our pre and post survey in order to obtain those CEUs and for us to be able to get the incredible data that helps to guide our work and helps us to know who's going to be with us today and hopefully for future webinars as well. Let's see here. So with that being said, I'm going to go ahead and put up our first pre-survey. And this is going to give us a bit of an idea of who all we have with us today. And in doing so, I'm going to begin to allow for some screen sharing here and let our presentation get up and running. So again, we'll give y'all about a minute to complete that pre-survey. As a gentle reminder, we do archive all of our content on our website at www.schoolbehavioralhealth.org/BASC, as well as our YouTube channel. So let's see here. All right. And I have a personal excitement today for having Dr. Carlson with us. He was and is one of my favorite professors from my graduate studies at Carolina. So Dr. Carlson, thank you so very much for being generous and offering your time and your expertise to our community. Absolutely thrilled to have you here. And I'm going to go ahead and shut down our pre-survey, give you an idea of who is with us, and let you share with the group a little bit more about who you are and all of the wonderful things that you're doing within the field and just kind of in general. So here we go. So today we have with us an incredible number of students. That's fantastic. It looks like predominantly mental health professionals. Thank y'all so much for prioritizing this critical topic. And we've got a lot of room for growth as well as comfortability with the topic. So hopefully that will lend itself to some great conversation here at the end of our presentation. So, Dr. Carlson, I'm going to go ahead and turn it over to you.
All right, thank you so much, Taylor. And I very much appreciate the opportunity to do this presentation. I want to thank you and the Basque team for all that you guys do related to supporting families and children with disabilities throughout the state. You guys really do incredible work. I also want to mention, and I always think this is really important whenever I have the opportunity to present on this topic, that I think the true experts on this topic are the parents and families who have a child with a disability, and they're the ones who know most about this experience, and they're the ones who are navigating systems every day that aren't necessarily set up to support them. And so my hope too is that if we really want to know about the best ways to support parents, that we continue asking them and engaging them in these conversations. So just a little bit about me. As Taylor mentioned, I'm an associate professor in the counselor education program at USC. I'm the director for the Consortium for Family Strengthening Research, which is a multi-university collaboration with faculty and students across various universities. And so we engage in research together, but also mentorship opportunities together. And so many of the folks within CFSR I've been working with for years, and have helped with some of the research that I'll be talking about today. One other thing I'll mention is that I'm going to have to ask Taylor to advance slides for me, because as happens sometimes, literally just before the presentation, PowerPoint told me I was no longer able to access it for some reason. So thank you, Taylor. So the first thing I want to do is just talk a little bit about my positionality. So I want to give you a sense of where I'm coming from when I think about parents of children with disabilities. I'm coming from a family systems perspective. And so that essentially means that I'm taking the point of view that there is no identified patient, that in order to understand what's happening in a family, we need to understand the context within and surrounding that particular family. I'm also coming from the frame of reference that family systems and structures are vital for us as we adapt well in life. So I've got this diagram here, which is really kind of inspired by structural family therapy. Some of you may be familiar with that. But it really talks about the idea and importance of hierarchies and boundaries within families. And so when I think about a family who has a child with a disability, it's not much different than the way I think about any family unit. So the family comprises its own system, which is the larger circle here. But within that system, it's important to promote a healthy boundary around parent A and parent B, because when parent A and parent B are engaged in a healthy dynamic, there's a positive spillover effect that the child or children experience within the family. And I think this is particularly challenging for families of children with disabilities, and I'll talk about that a little bit more as we go along. But there's not just a spillover between the parents and the child. There can also be a spillover between the child and the parents. And so this is a bidirectional relationship. So the healthier the parents are, that healthy dynamic can spill over onto the child. And the same with a healthy child can spill over and have positive influence on parents as well. But conversely, if parents aren't doing well or aren't doing well in their relationship, that can spill over and adversely affect children. And if children's behaviors are a problem, or children are struggling, that can spill over and affect parents as well. And so I just want to keep this frame of reference in mind as we talk about this for today. And I'll pull it back in and reference it at different times as well. So continuing with some context, a healthy and stable parental relationship is one of the best predictor of child outcomes. This research has been going on for years. There are several studies that show this in different contexts. So again, kind of referencing the idea of the spillover hypothesis here. I also want to mention that as it relates to parents of kids with disabilities and thinking about families in general, the field has really moved away from a pathological approach. And I think this context fits in nicely with a family systems framework, because we don't think about one person as being the problem within the family. We think about families who experience challenges or experience different circumstances in life that require the entire system to make an adjustment. And so the focus of what I'm going to talk about today is about healthy family adjustment. It's not about supporting parents as they navigate one problem, but it's thinking about the family as a whole. So we're also going to focus on things or characteristics of families who adjust well, and things that kind of stand out among those families. And in the spirit of not taking a pathological approach, I think it's also important to think about the way we refer to a child with a disability in a family. And so using language like child with autism as opposed to autistic child helps to let families know, especially when we're talking with families, know right away that we understand their child is more than what they're diagnosed with, that they are a person beyond that diagnosis as well. And so again, I just kind of wanted to mention that as additional context here. Next slide, thanks. Okay, so this is a family that I'm going to use as a case example, and to try to provide some practical examples to some of the things that I talk about. But I met Jim and Mary years ago through some relationship education programming that I was involved with. And they came because they wanted help with their relationship. So they're a married couple with 2 children, Andrew and Ben. Their son Andrew was diagnosed with spina bifida. So this is caused when the spine and the spinal cord don't form properly in utero. Mary quit her job after Andrew was born so that she could spend more time helping him receive treatment. And Jim worked for a large home construction company, but lost his job due to an economic downturn. So this was around 2009. Jim is quiet and internalizes, while Mary is more talkative and externalizes. They came to counseling, really they came to relationship education programming because they've been feeling distant, and Mary feels alone as she navigates Andrew's diagnosis. Okay, next slide. Okay, so as many of you might know, the prevalence for diagnosis has been increasing. And so there's been about a 17% increase for children 3 to 17 who received a developmental disability diagnosis between 2009 and 2017. In particular, there's been an increase with diagnoses of ADHD, autism, and intellectual disabilities. Part of the reason that there's been an increase in these diagnoses is because of more awareness. Also, there's, I think, less stigma about reaching out for help, better screening. In some respects, diagnoses and diagnostic criteria have changed, and also better accessibility with services, especially considering school mental health initiatives that have been going on and continuing to increase in their prevalence. So for those who currently support families, it's likely we're going to continue seeing more families. For those who haven't had the opportunity to work with families, you likely will. And I also want to mention too that what these prevalence rates don't take into consideration are families who have children who don't formally meet a criteria for a diagnosis. So maybe they're sub-threshold, but they still exhibit some of the same symptoms or behaviors along various continuum of behaviors that children who have a formal diagnosis might experience. And I think it's important to consider those families in this context as well, because they experience some of the same challenges. It's just they don't have that formal diagnosis that others may have as well. Next slide. So we'll start with some of the positive aspects that have been identified when families have been able to adjust well to a child with the diagnosis. They typically report being stronger as a family. They appreciate life's simplicities. They tend to demonstrate more compassion and patience. If there is a married couple or parents, they report having more stable marital relationship. They generally feel more fulfilled in their role. And they believe that the diagnosis brought the family closer together. So I think this is an example of some positive spillover that can occur, but it doesn't occur by happenstance. These things, for families, when they adjust well, there are intentional strategies, intentional things that happen within the family that can create this positive adjustment. In family systems, one of the concepts that we talk about is this notion of homeostasis, which is really a concept that comes from the world of biology. But it's the idea that systems naturally seek stability, look for balance and stability. But things happen that create waves that create challenges to that stability. So when when a system encounters some experience, in order to achieve homeostasis again, there has to be some level of intentional adjustment. And so when we talk about families who have adjusted well, we're talking about families who have regained a sense of homeostasis or a new normal. And they've done that intentionally, and they feel like they come through this better off than they were before. Next slide. So conversely, thinking about the spillover hypothesis and the other side of this, that when there are behavior problems with children, it's closely related to family and marital functioning. That family caregivers who are raising kids with disabilities are at a greater risk for psychological distress. So, typically that means experiencing anxiety or depression, sometimes hopelessness, and that can contribute to lower quality parenting, which is going to impact child development and also contribute to behavioral difficulties. And so when we get this sort of negative feedback loop that can occur. And this is sort of an example that of something we call circular causality. So the idea is that in family systems, everybody has a role to play. And so when things are going well, there can be a ripple effect for everybody else in the family. But when things aren't going well, there's no blaming. Everybody can make a difference. So all it takes is one person to do something different that can create a positive effect on the rest of the family. And so that's that circular causality there. Something else I wanted to mention that came from some of our research about 10 years ago, we compared experiences of families who had a child with a disability versus families who had a child that was typically developing. And one of the things that we've found that was somewhat striking, but also not entirely surprising, was that on an average of 6 months, families of kids with a disability attend about 50 doctor's visits, compared to 0.5 for typically developing children. That's a typo there. So that's per 6 month period, not per month. And I think this is really important because not only is there, when a diagnosis is made, does that create a disruption to the family system that can involve some of the psychological stressors and things of that nature. But there are also pragmatic and very practical things that need to be dealt with that can involve attending lots of doctor's appointments. So in the case of Jim and Mary quit her job right away because she knew she was going to have to take Andrew to these doctor's visits. So that creates a financial burden on the family, particularly if they were a dual income family. Not only are they out that income, but they may have to pay for more copays or out-of-pocket visits, additional therapy appointments. And so there are contextual stressors or challenges that families are facing that families who have typically developing children might not necessarily be facing. And in the case of Jim and Mary, Jim happened to lose his job at the same time. So there was quite a bit of angst just simply surrounding finances here as well. Next slide. So there are some important differences, I think, to understand between how men and women or moms and dads navigate the experience of a diagnosis for their child. You know, the type of diagnosis can mean different things for when the actual diagnosis occurs. So whether the diagnosis occurs in utero at the time of birth, or maybe in many cases, like for ADHD diagnoses, not until high school or middle school, right? So fathers tend to experience more depression, but it's internalized depression at the time of diagnosis. So they're suppressing those feelings. And so it may not be obvious that they're experiencing these feelings of depression. There is a sense of grief and potentially some loss, depending on the diagnosis and what it might mean for their child or their idealized experience of their child. So there is some grief that might occur around this time as well. And stereotypically, this isn't the case for all dads, but stereotypically they exhibit less mastery over their coping skills. And so they withdraw or avoid. And that may take the appearance of being uninvolved. These characteristics describe Jim to a T. This is exactly how Jim was when he came to participate in relationship education. He had the appearance of being withdrawn. He was quiet. He didn't share a lot. When he did share, they were often one-word responses, and so it was tough to know what was really going on for him. And so it can be helpful for parents to hear this, because it can help normalize their experience. And I'll say more about that in a minute. Next slide. So on the other hand, moms tend to experience more shock at the time of diagnosis. They're more overt in how they're showing their feelings. Their feelings are typically more ongoing. And in addition to depression, there might be a lot of feelings of guilt that moms experience. But they're also more likely to be engaged. So stereotypically, the person who's taking who's taking the child to all of their appointments is mom. And again, in the case of Mary, she was the one who drove Andrew to all of his appointments and gave up her previous career to do that. So what can happen here is a dynamic can inadvertently be created where it looks like you have one person doing all the work and the other person not doing much of anything or showing much emotion about anything either. And so you can imagine that might create some strife. A metaphor that I like, because I'm a sports fan, is thinking about, from a football perspective, a huddle versus a no huddle offense. I'm a Patriots fan, and so I love Tom Brady. Tom Brady is at his best when he's in a no huddle offense. There, if his team is down by a touchdown or a field goal, he's known for driving them down the field. They don't discuss the plays. He's at the line of scrimmage. He's managing what's happening and on the fly. This is kind of like what happens to moms. They often become experts on their child's diagnosis and treatment as well. They often learn a lot more than some medical professionals as well. Whereas dads tend to like being in the huddle. Let's talk it through. Let's create our plan. And so there's a different approach to how they're addressing the potential challenges that they might be facing. Next slide. So research has shown that there are a handful of characteristics that have been identified in families who adjust well. So broadly, they're social supports, using positive coping skills, religious coping, parental responsiveness, relationship harmony, their ability to work as a team, and more effective parenting. So we'll briefly go through these next. Go ahead. All right, so social supports are important for a number of reasons. And it's the quality, not the quantity. So it's not about having 10 best friends, but maybe about having one solid friend group. People who mom and dad feel like accept their family, and really appreciate what they're navigating. People they trust, people who can be there for them, perhaps even provide trusted childcare for them. This is really important for dads because many times for fathers, it's their perceptions of social acceptance that causes them a lot of distress, wondering what are people gonna think about their family, or what types of judgments might they face. But so having these strong social supports can be really helpful for families to feel accepted. Mary was very good about creating social supports. She was well connected to the resources in her community, and those resources she was able to leverage to help them with childcare, even the childcare to participate in the relationship support services that they were receiving. And so I think this is where a knowledge of local supports and resources for families that are familiar with and understand what families navigate is really important here. Next step. Next slide. Positive coping skills is something else that's identified in families who have adjusted well. Positive coping strategies help to curb any of the psychological stress that families may be at risk of experiencing. So when we think about approach versus avoidance behaviors, positive coping skills are associated with approach behaviors, a feeling like you can address the issue, but address it in a manner that's productive and healthy, right? So some of the things that can contribute to positive coping strategies are reframing skills, thinking about a challenging situation and looking for the opportunity in the challenging situation. So if we remember what some of the qualities or some of the things that families who adapted well said, they viewed this as an opportunity to come closer together, to work together as a team. They saw their family as more bonded, right? So helping people to develop those reframing skills, and not focus on what might be considered negative aspects. They used optimism and a sense of humor. And I think this transcends beyond just parents of kids with disability as well. The use of optimism and humor in a situation, but not to avoid addressing it, but to help with reframing, to create a sense of ability and agency to approach the situation. Next slide. Religious coping and spirituality have also been identified as positive qualities for families who adapt well. They often feel like their spiritual convictions are stronger after having the child. They seek out spiritual support, and those spiritual communities can also become a place where they're receiving social support. So you can see there's overlap between all of these areas as well. They find meaning in the different situations that they're navigating. And in the therapy world, you know, we talk about existentialism and the importance of meaning and purpose. These qualities are associated with higher self-esteem, better psychological adjustment, lower stress, and really a feeling of overall higher levels of religious and spiritual growth. Next slide. Okay, so parental responsiveness is really this idea of, I think this ties into an approach coping skill as well. So being responsive to the needs of their family and the things that are happening within the family. So responsiveness is related to a child's development and engagement behaviors. So families who feel close together experience less depression and feel better equipped. They're more responsive, so better equipped to address challenges that are facing them. So again, we see the overlap between some of these characteristics and qualities. Next slide. So the parental relationship, and this is one that I think is vital. And for many of the reasons that I've already talked about, it's also one that is easy for parents to overlook. You know, as parents, regardless of what your children might be navigating, it's often hard to put our relationships first. We often want to put what's going on for our children first. But for parents who are navigating a child with a disability, emphasizing and prioritizing their relationship is of utmost importance. So developing positive relationship coping skills together, learning how to communicate in an effective manner, learning how to navigate conversations where maybe they have a different style or a different solution to a particular challenge that they're navigating based on different styles. Remember, men and women handle stressors differently, right? So having the skills to navigate those conversations in a constructive way is really important. And so this allows them to distribute any caregiving responsibilities in a more equal manner, where they're feeling like they're both involved and they both have a role to play. it can provide them an opportunity to spend more leisure time together, which is really important, spending quality time together so they can feel refreshed and rejuvenated within their relationship. This results in higher self-esteem for both of them, and feeling like they have the support of their spouse, which is really important. When Jim and Mary first showed up, they did not feel supported by each other. They felt like they were missing each other. And so our focus was helping them to understand each other and their coping style, so that then they felt supported and not like the other person didn't care, or that so Mary might have thought Jim didn't care based on his avoidant approach. And Jim may have felt like his opinion or perspective didn't really matter because Mary was taking care of everything. And so through learning skills and strategies to communicate with each other, as well as understanding their differences and how they address different things the family's experiences, they were able to better understand their coping approach and then negotiate strategies for equal distribution of caregiving and supporting each other. Next slide. Okay, so one of the things that I think we can do based on this research about positive characteristics for families who've adjusted well, and thinking about families from a systemic perspective, it's important for us to understand when we're working with a family, regardless of the capacity with which we're working with them, what are their strengths? What are their areas for growth? I don't like to use the term weakness because, again, we're coming from a strength-based perspective here. So in what areas are they maybe doing better? And in what areas do they need to improve? So Jim and Mary were doing well with some aspects of social support, but it was kind of one-sided social support. They weren't doing well. One of their areas for growth was in parental distress, reducing that, and in developing positive coping skills. So we developed a measure called the Family Adjustment Measure. That's a questionnaire that can be given to families, to either both members, both parents, or one parent, and it assesses them in these 4 areas to provide a sense of where they're doing well and what their areas for growth are. But you could also ask open-ended questions, kind of with the face valid open-ended questions within each of these domains. So for example, can you tell me a little bit about the types of social support that you guys have, right? Remember when I started the presentation, I talked about the importance of getting the perspective of parents. And so before we can really know how to best support them, we need to ask them about where they are with these types of things. Tell us about how you guys cope with some of the challenges that you're navigating in your family. How would you describe your coping skills? So you can ask these types of open-ended questions to get a sense maybe of what's going well for them, and maybe what areas that we could help them improve upon. Next slide. A few years ago, I had the opportunity to be involved in a project with some colleagues at USC, and we interviewed 14 parents of high school kids who were involved in the IEP process. And we wanted to know what their experience was and what are some of the things that they wanted. And some of the things that stood out to us were that they wanted a proactive approach. They really valued when school personnel, whether that be the special ed teacher, a counselor, whether it's a school counselor or a mental health counselor, were reaching out to them before a problem was so serious they couldn't fix it. So whether that was a grade in a certain class, that was a frequent example that they gave, or something else going on at school. They also really wanted their perspective they wanted to feel valued when they were thinking about what goals were going to be created for their IEP plan. They emphasize the importance of having regular communication with teachers and school personnel, and these are things that can be challenging for many different reasons. Probably from a larger systemic perspective, systems are not always in place to create this type of communication. But I think this is the type of support that parents were really telling us that they were looking for. And again, I think this applies for parents of children who have a formal diagnosis and those who maybe exhibit some symptoms but are sub-threshold. The other thing that I would add here is that I think parents really wanted to be validated in their perspective, in their experiences. They wanted to feel heard and understood. So using active listening skills, I think, is really helpful for parents at this stage. They obviously was not a positive experience if they felt like their concerns were being dismissed or sort of minimized based on the things that they might have been expressing. So some strategies. So I have 11 strategies to consider when supporting families. I like even numbers, but I didn't feel like I could cut one to get it back down to 10. So I think the first one is to identify family strengths, whether that's through open-ended questions or using something like a family adjustment measure. What is the family doing well? Strengths and expressly and overtly telling families what their strengths are instills hope. And so I think that's very important here. Helping parents to recognize each partner's coping approach, understanding what their approach is and what are some of the reasons for their approach. This was probably the single most helpful thing that Jim and Mary experienced, was understanding each other's approach. That their approach isn't personal. It's based on a lot of other things they've experienced in their lives. Maybe it's not the best approach to resolve what they're experiencing, but it's not personal, right? So we first need to help them understand that before they might be able to move towards identifying solutions that work for them. Encouraging them to communicate their needs, mostly with each other, but also with the team of people who might be supporting them. Again, school-based personnel, mental health personnel, doctors, whoever that might be. Many times we're all guilty of this. We live with this sort of belief system that if people really cared, they would ask or would just know. Lori Gordon calls that a love knot. But that's obviously not rooted in reality, right? So in order to get our needs met, we have to communicate what those needs are. We need to be listening for the needs when they're communicating. Partners need to be listening for those needs when they're communicating so that we have a chance to meet those needs. Each member of the couple is on the same team. I think we could probably say that this applies to the larger team of support in general, but specifically for parents, even if they're not in an active relationship, if they're co-parenting together, it's important that we help them remember that they're on the same team. So if we externalize the problem, this is something that comes from narrative therapy, we can help them work together as a family system to overcome any challenges they may be experiencing, rather than feeling like they're butting heads and that other people in the family are the problem, right? So helping them to externalize the problem, feel like they're a team, a cohesive team, and working together to overcome that. Don't forget about dad. Again, this is based on some of the stereotypes, but supported by research that that I talked about earlier, because dads can often be quieter and take that avoidance approach and internalize. But it doesn't mean they're not experiencing things. It also doesn't mean that they don't want to be involved. A story that I often tell my students is a time where my son had croup. He was about 2 at the time. I didn't know what croup was. I was just really worried because we heard a lot of wheezing. I slept on the floor while he was in his crib that night. I was very concerned about him. We went to the doctor, my wife, myself, and my son, and the nurse kept asking my wife questions that I was answering, but she was still looking at my wife and asking her questions. And so I think sometimes there is the tendency to assume that one parent knows more than the other, and we leave the other one out. Next slide. So along those same lines, I think it's important not to forget about the typically developing siblings as well. One of my former students, Dr. Rufus Wofford, has done some research in this area and really underscores the experiences that typically developing siblings might be having and how they can sometimes feel like the forgotten children. So if we take that family systems mindset, everybody has a role to play, an important role to play in the system. So it's not just about one identified person. It's about everybody in the system who's working towards adapting and adjusting to develop healthy homeostasis. Help the couple identify social supports. Talked about this quite a bit. Help parents find trusted childcare. This is especially important for parents who have a child with a disability, trusting that somebody who is watching their children knows and understands their child and understands the experiences of their child. Without that, it's very difficult for parents to find quality time to spend together. So these can be very practical things that we might be able to help parents with. Normalize their struggle, and in the idea, from the perspective that many times when parents are struggling, and again, I don't think you have to have a child with a disability to fully understand this, parents have a natural tendency to tell ourselves we're doing it wrong, we're screwing it up, and then to feel guilt. And then that guilt leads us to do things that maybe aren't in the best interest of ourselves or even our children. And so it can be helpful just to hear someone validate that sometimes there are challenging situations and we don't always know how to address them in the best way. And so that we do the best we can at that particular time. Because that type of a reframe is more productive than parents who are beating themselves up because they feel like they're not getting it right all the time. Encouraging the couple to spend quality time together. And I would suggest even asking them if they have gone to counseling to support their relationship. It doesn't always have to be when there are problems occurring that folks attend counseling, attending in a proactive manner, or as just an opportunity to spend quality time together. My colleagues and I recently did an analysis of couples who were randomly assigned to receive a relationship intervention versus a waitlist control group. And we found that the quality time that couples spend together was one of the biggest facilitators of positive change within the relationship. So the quality time that they spend together while being engaged in that relationship intervention, knowing that their kids are being taken care of and knowing that they have that time to focus on each other is invaluable. And so I think that's in line with my last point here, which is it's okay for couples to prioritize their relationship, or parents to prioritize their relationship, or if it's a single parent, for that parent to prioritize their well-being and overall wellness. It's okay. And I think it's important for us to be encouraging of that. Next slide. So lastly, I just want to mention a few resources. You can scan these with your camera or a QR code reader. The first one will take you to a list of resources in the state of South Carolina provided by the Department of Education. A lot of parenting resources available there. The second one will take you to a website that talks about a program called Our Relationship. And this is a fully online asynchronous relationship education program that folks can participate in. It's about 8 hours of content, either together as a couple or one parent on their own. And there's some strong research supporting the effectiveness of this particular approach as well. And then the last one will take you to, in the College of Education, we have a Center for Community Counseling where we're able to provide on kind of a limited basis counseling at no cost to folks in the community. So we're on hiatus for the summer, but we'll be resuming in the fall. And so this could be a great resource for folks, particularly for folks who may not have the financial resources or to receive counseling or therapy in the community. So with that, I will stop and would love to hear any questions or comments that folks might have.
This is phenomenal. Thank you so much, Dr. Carlson. I was smiling at just having those concrete strategies and thinking about how we can apply them in larger systems. I'm hoping that you all utilize your chat box and type any questions either directly or to the entire group for Dr. Carlson. If you would prefer to ask a compassionate curiosity anonymously, you can use your Q&A. I'd love to go ahead and get us started if that's possible, if that's all right with you, Dr. Carlson. I was curious about recommendations that you may have for intentional strategies that larger systems can take to promote homeostasis, normalization, and increasing that social connectedness or that perception of social support. So thinking about school systems or district level.
Yeah, so I'm not going to say I know all of what happens at the school district level to support families, particularly children. My experience is that a lot of what happens, or a lot of the supports are available are to support the child, resources or strategies for the child, and then educating parents on their child's diagnosis, or educating parents on things that their child might be experiencing, which is important. However, I think it misses what the whole premise of my presentation today is, which is on things that directly get at the quality of the parents' relationships and directly get at the quality of even the parent and child relationship. So making it as much about the parents and what they need to do as it is about their children and what their children need to do. I think that would be a fairly significant systemic shift. That would be important. It's not always comfortable, but an important one.
That's fantastic. We do have a question that came in. Would you feel as if positive coping skills are acceptable techniques in parent management training? What other techniques can be implemented in PMT for successful outcomes for both the parent and child?
So I think when I think of parent management training, and I apologize if I'm wrong, but I think of behavioral strategies, right? And so in line with that, I think there are behavioral strategies that are very much associated with positive coping skills. Cognitive restructuring is a behavioral strategy. So taking inventory of our thoughts about something, reframing what we're thinking, and understanding how that influences the way we feel and act, right? The relationship that exists between thoughts, feelings, and actions is, I think, certainly an option here for parent management training, that is reframing our thoughts that have to do with us and how we're viewing our kids, so that we can better be in a position to better manage our child. So not just managing their behavior, but managing our behavior. That's really the I think important emphasis here. And through that, there's a positive spillover that occurs. I mean, most of us can relate to that. If you've had a rough day at work and you come home and your kids aren't on their best behavior, it's hard to maintain patience, versus if we had a really great day at work and we come home and a lot of great things happen, then it's, we're in a more jovial mood, right? So I think that's kind of a more simplistic example. But yeah, I do think that it's appropriate and very much related to incorporate some basic cognitive restructuring strategies.
That's phenomenal in my mind, thinking about, how are we translating those social emotional skills that we're teaching in the classroom and having our parent or caregiver dyads be able to model that in the home.
Absolutely. Yeah. So we talk a lot about emotion regulation for our kids and learning to manage their behaviors through regulating their emotions, but we need to regulate our emotions as well.
Absolutely. Well, I'm going to look and see if we've got any additional questions here on our Facebook Live. All right. So it looks like we have attended to all of our compassionate curiosities today. This was an incredible presentation, Dr. Carlson. We're so very grateful for your time and your expertise. I cannot wait to share this on our website and have it archived on our YouTube, and be able to promote this broadly. Again, we thank you so much. I'm going to take just a moment here to do our post survey. So if you all that are still here with us would go ahead and complete that brief poll, we would be so very grateful. Again, Dr. Carlson, thank you so very much. We really, really appreciate just being able to have this community of practice and continue these critical conversations and think about how they apply to this multidisciplinary audience. In hopes that we can do a little bit of teamwork makes the dream work. Do want to say thank you so much to the Office of Special Education Services, who is our partner and funder for the Behavioral Alliance of South Carolina. We hope that you all will engage with us by following us on Facebook at BBA of SC, that's B Basque, as well as on Twitter. You can sign up for our newsletter so you can hear about all of the wonderful webinars, including this one and all of the additional resources that Basque offers to our communities. Become a greater partner within Basque and the SSBHC by signing up for our newsletter on our website, www.schoolbehavioralhealth.org. So with that, we will offer 2 minutes of additional self-care time for everyone to hopefully escape the office a little bit early if you can, or sit and digest all of this wonderful information. So you all have a fantastic day. We will see you next month. Register for our following webinar. And Dr. Carlson, I hope you have a lovely evening, and we look forward to seeing you here very soon.
Thanks so much, Taylor. Take care.
All right. Y'all have a good one. Bye-bye now.